Everybody, welcome back to Healthcare Americana, the podcast featuring all the free thinkers, innovators, and people out there who actually want to change healthcare for the better. I am your host, Christopher Habig, the CEO and co-founder of Freedom Healthworks. And today I wanted to jump right into the episode, skip the normal monologue, skip the normal intro, setting the table, because today's guest, he speaks for himself. He is a titan in the industry. So I'm happy to have Carl Schuessler, the co-founder and managing principal at Mitigate Partners, joining us here today on the podcast. Carl, good to finally have you booked. Good to finally talk to you here. I know we've been talking about this for quite a while. So thanks for putting the schedule together, and glad, the stars aligned where we could talk together.
Hey, thanks, Chris, for having me. It's an honor. I've obviously listened to the podcast for a long time. I think the first time was Dr. Avi Barr down in Macon, Georgia, where I'm originally from. I got introduced to him by Dave Chase several years ago and so forth. So I heard that one. And then obviously my good friend Christy Gupton's been on, and, other folks that we're familiar with. So I appreciate the opportunity, and congratulations also on a pretty recent childbirth, I understand.
She just turned 3 months yesterday, actually. So it's been a whirlwind, and I appreciate that. And yeah, all friends of the podcast there, and friends of Freedom Healthworks that you listed out there. And I can't have a conversation with you without talking SEC football. I know that's not why we're here to talk about this right now, but this past week, Lane Kiffin and Ole Miss gave Nick Saban and Alabama a run for their money. And I'm like, holy cow, Carl's going to have a lot of opinions about this one. And what are you seeing out there, man? What are you seeing in the college football landscape, especially in the Southeast?
Well, I tell you what, Chris, don't throw me in that briar patch. That's we might not get out of here for an hour. Hotty toddy, gosh almighty, who the hell are we? Hey, flam flam, bam bam, Ole Miss by damn. My wife went to Ole Miss. My son is a sophomore at Ole Miss. So obviously I was up even in my weakened state watching that game all the way to the end. But it's been I tell you, SEC football started on September 26th, which is another birthday of a great American you're probably not familiar with, being me. That was my birthday, and that's when SEC football started. So it was a heck of a gift. Otherwise, I don't know what I was going to do with my mental health state. I love the Saturday mentality. So it's been fun. My dogs are getting it done. I hope that they'll, get it done this weekend in Tinseltown. We'll see. It's going to be a big challenge, but yeah, good to have college football back. And you can see behind me, prettiest stadium in the world behind me.
A lot of University of Georgia love going on right there behind you. Yeah, it's been interesting because they just jumped right into conference play, and you don't have kind of those warm-up games happening, and we'll see. I'm up in Big Ten country, so we'll see if they actually get their act together and get going here. But I couldn't believe that they were holding out and saying, we're probably not going to have a season.
Listen, all the thought-provoking and knowledge comes from the South, Chris. So it all has to seep up north. We understand that y'all had to copy us and realize we need to play.
Well, I think it's the slower life. You guys take time to actually sit down and think about things rather than just rushing into a decision like us Northerners here do. It's a different pace. But hey, Carl, you mentioned your weekend state. I just want to make listeners know that you and your family, unfortunately, did contract COVID. So you're joining us virtually, obviously, here. So we want to talk a little bit about your experiences, because this is something that we've never done here on the show, is actually talk to somebody who's living through diseases caused this terrible global pandemic. So we definitely want to get to that. But again, thanks for taking time and getting the energy up and getting all dressed up as well to come out and join us here on the podcast. But what we do want to talk about is this continuing series that we've been doing, talking to brokers and talking to people more in the benefits industry and more along those insurance lines, the health insurance lines, because, for the life of us, every time we talk to somebody, it's like something has to change, right? Somebody has to wake up and say, there is a better way of doing this. And that's why I was excited for this, because you're one of the people who put something together in the DeSoto Memorial Hospital And I'll let you tell the story about that because it is absolutely fascinating. And if you're somebody who's not familiar with it, then it needs to be on your radar. So the reason why I was excited, just to bookend that, was because you got something done, right? You're not one of those brokers who sits there and just wants to use DPC as a prospecting tool and get out there and get new business. And you're not putting benefits plans in where you're just getting, your back scratched and, screw everybody else. So give us kind of the rundown here of Mitigate Partners and how this whole thing came together. I know it's a lengthy story, and we got plenty of time if you've got the energy to do it. So let's hear it right from your mouth, because I'm not going to do justice with it. So tell us all about what happened, what went down, and the players involved, because they are some titans of the industry, I would say.
Yeah, well, thanks, Chris. It's a true honor to be a part of it. And just a quick, I've been known to be a storyteller from time to time. So I'll tell you a quick one. I can't say hello in less than 5 minutes, just so you know that. But anyway, my father, my dad was a 40-year OBGYN in Macon, Georgia. Many people that are listening know that. And he retired January 15. But back a long time ago, when we put in a high deductible health plan for his practice, when it wasn't cool, it was new. I'll never forget, it was the summertime. Actually, Georgia was playing the College World Series, and he and I were going to watch the game. But his as he says, his gals in the office, they had a meeting with the gals and all. And I know you could get in trouble for saying that today's times, but they were meeting and blah, 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 blah. And, the air turns off in those buildings, and I'm all dressed up. So it's getting pretty hot. And I'm like, good Lord, when are they going to be done in there? They finally got done. So I came in there and I had a presentation and I spent a lot of time on it. And my dad goes, son, please tell me you're not going to go through all that. And I said, thanks a lot, Pop. So in front of all his partners. So, and I did have to speed it up, but I've been known to not be short on words. But anyway, so yeah, the joke used to be, you can't say hello in less than 5 minutes.
I like that.
So yeah, hey, Chris, there's nothing wrong. And I say to everyone, I'm in touch with myself and I know who I am. And I know my creator made me that way, and I ain't going to change. So if you don't like it, don't have me on the show. That's how I roll. So that's the ABCs of me, baby. But anyway, it all started around right after Thanksgiving of 17. Another benefits advisor. By the way, I heard you call a broker. Don't call me a broker, brother, because I'll bring COVID up north, son. Don't be doing that. You call me an advisor.
There we go. That's my apologies there. My apologies. I think I did quickly correct myself, though.
Yeah, I know you knew about that. Your brother Adam and I had a good time talking about that, and Melissa. But so long story short, this other advisor had connected us with Dr. Lee Gross, who's very well known as one of the top DPCs in the country. He's in the short list up in DC at a lot of these meetings. When they were meeting regularly, he was very involved. And we got to know Lee. The reason Lee was interested in what we were doing is because we had put together a plan called the Fair Cost Health Plan. And he wanted something, he had not seen anyone do this, to be able to take DPC and just slide it right in there. And that's basically what happened. So we went around November 17. We did not get hired on the spot, shocking. And we then had another meeting in May, and then had another meeting. I think it was probably 2 subsequent meetings, maybe like that. And by August of 18, DeSoto hired us to be their advisor, myself and the co-founder of Mitigate Partners, Barry Murphy. So we were hired then and got going, had some pretty tough orders to make changes and get rid of a BUCA, Blue Cross United Signet, and Humana for you folks out there, a BUCA TPA that I'm not at liberty, I'm not going to discuss it here in the details, and one of the big PBMs that comes along with that. So pharmacy benefit manager or program bilking millions, however you want to view it. I view it as program bilking millions. So we had to immediately, because of the timing, and you got 60-day outs of contracts, we had to quickly get information from these people. And I got them to like me somehow. I know that's hard to believe with the time you spent with me so far, but they actually liked me, and we were able to get information and so forth, and then had to unfortunately fire them. And so October 1, is their stop loss plan year. Their plan year is a calendar year, so January 1. So for 3 months, we stayed with the current third-party administrator, run by Buca. And January 1 came and we flipped to fair cost. And just quickly to go down the deal, we put in all our solutions in our fair cost health plan. It's over 16 seamlessly integrated solutions. Went with an independent TPA and put all that in. And it was a big deal, Chris. I mean, this is the 4th poorest county in the state of Florida. The per capita income is $25,430. The hospital has struggled. They lost obstetrics in February of 18. So, it's a 49-bed hospital in a very poor area. And so it was really significant what then happened. So as we look back a year, we got into the end of September and we look back 3 months on a Buca plan and 9 months on fair cost. And what was amazing is 7 months into fair cost, we had spent, I think with the Buca for 3 months, we spent about $310,000. With fair cost, it was like $478 in 7 months.
Jeez.
It's amazing. If you get it 2.5 times the months and barely more money. So that was quite amazing. So overall, they had spent, their plan was about $2.2 million when we met them. They were running about $14,000 per employee per year. And we wrapped up the first year around $990,000. So they saved $1.2 million or 54%. They saved $150,000 in their stop loss premiums because of fair cost and the credit and the street credit has with stop loss carriers about how significant cost containment risk mitigation is involved here. And DPC is the foundational component. Mm-hmm. You imagine a home built brick by brick, DPC is the foundation. And so, I mean, Dr. Gross, we could beat our chest and say we're great, we're smart. But the truth is, it's a combination of a lot of factors. I think Dr. Gross, the hospital, Chris, the hospital having the insight to put in DPC when they own their own doctors. I don't think people are grasping the significance of that. So they saw the value in it. And Dr. Gross, they also inherited some of the most unhealthy patients. I'll never forget, we had a meeting on October 1st of 2018. I'll never forget that day, is we built the fair cost plan and what we called the Soto Memorial built healthcare or community built healthcare, not insurer built healthcare. Very big difference. Mm-hmm. It was a 5-hour meeting from 1 in the afternoon till 6 at night. So it was a 5-hour meeting, and I'm sure none of them will ever forget it, especially because they had to be with me that long. But Murph was there, my buddy Murphy, and our network development partner, our Charleston Quality Company, Dr. Gross, and his right-hand person, Ann Horner, and the hospital. The stop loss partner was there. I mean, these people don't come to all these meetings. And it was quite amazing what happened. And I mean, literally 157 employees was able to save $150,000 in their stop loss premium. Really? I mean, that's
real
crazy.
Dollars too. Right. Yeah.
You tell that's 58%, Chris, of what they were paying. 58% savings. But overall, long term, the truth is, I think we had a good claims year. I think we redirected care back to their own facility. This is important, Chris, and I'll shut up. I'm sorry. I'm shocked that I'm able to be rambling like.
Hey, you're the storyteller. I asked you about it.
Well, yeah, but it needs to get to a point. So anyway, anyhow, what was I trying to say? We literally, as we went through it, I'll never forget it as I kind of retraced the steps. You have to really look at this thing as a good claims year, but you also have to look at it because of the significant role Dr. Gross and his partner, Dr. Crouch at Epiphany, brought here in the care levels, the cutting down downstream specialty referrals, cutting down ER admits, being a doctor the way you were trained to be, practicing what you wanted to do and not reporting to insurance companies, all these middle people, as we call them the middles, eliminate the middles. That's how you make it work. So Dr. Gross, we did a lot of stuff. We had to connect their referral pattern, their specialists they liked in the area vetted by our cost and quality company, then preferential treatment, pre-cert sacrifices made here and there in the plan. We had a customized pre-cert list for their hospital and external hospitals. We call them foreign hospitals. It's called foreign medical spend. But here's the bigger thing, Chris, and this is what I was trying to get to. I'm sorry. When we met them, their foreign medical spend had been around, I think it was right around 78%. So that means that 78% of every claim dollar spent on their own employees was going outside of DeSoto Memorial Hospital. That's a lot of money leaving the hospital. And you, Chris, you got a couple things going on. Hey, I'm Carl. I've worked at the hospital 25 years. Ain't no way I'm gonna let Dr. Betty see me naked. I'm going somewhere else.
Sure.
And you got a little bit of that going in a county of 38,000 people. That's going to happen. But the hospital is a wonderful hospital. It's a 4-star CMS hospital. There are only like 19 of those in Florida. So it's 49 beds. It's not massive, but it's a tremendous quality hospital. That's what's even bigger deal about this. So anyway, when we got finished with the first year, the medical spend, foreign medical spend was reduced to 62% in 1 year. And I think that's what we're most proud of. And the hospital themselves said, we weaponized the plan design, redesigned the plan design, and got rid of deductibles to go to their own hospital.
Mm-hmm.
When we met them, it was the same deductible if you went to Moffitt Cancer Center in Tampa as it is to go to their own hospital.
Right.
And that little change was substantial. You've seen the videos. You've seen Hannah had a cancer surgery, estimated cost $42,000. She paid $0. I mean, those stories are out there. They're on Patient Rights Advocate website right now. You can watch some video. So, you know, it's quite amazing. So I think we're most proud of that. And I really, Dr. Gross and Dr. Crouch are the foundational building block in that employer built, custom built home, if you will. I like that analogy. You're building a house brick by brick. They're in that bottom part, that foundation, and that had everything to do with why we were successful. And we also have some cost containment risk mitigation outside. I apologize. That was, is our time up? Sorry.
Yeah, almost. No, I'm kidding. We got plenty of time here. And that's, I appreciate the depth of the story too, because it's something that frustrates a lot of people out there who are looking to exercise alternative plans or put them in, or how do I build this? And it comes down to it, like you said, there's 16 different pieces, brick by brick. So, you know, before we continue down that path, you said something interesting to me that, you know, was there any pushback from the hospital physician saying, wait a minute, why are we using somebody outside of our hospital to care for people?
No, we really didn't get as much. And it's not like they own a bunch of doctors either. I mean, they're not a huge hospital, right? They're not like some of these behemoth, and certainly, as I like to call, cartelish hospitals out there. They're certainly not like that. And I think as we went through this process too, Chris, and we're reaching out and trying to build what we call a DeSoto Friends and Family. Mm-hmm. We had a tiered benefit plan, so we had like 3 tiers, and the tier 2 was DeSoto Friends and Family, and they learned real quick. I'll never forget when I met them, I used the word cartel. And everybody knows me as the pink pants cartel guy. By the way, I don't have pink pants on. I have khaki pants on today. But
thanks for showing us. Yeah, just for confirmation.
Well, it ain't spring. It's the fall down here in Georgia, and the leaves are turning, so you can't be wearing pink right now. But anywho, we I lost my train of thought there.
Well, I was asking, so, you know, if I'm a primary care doctor in this hospital system, and then they implement care from a physician who's not in the hospital system, and they're getting better quality, they're getting better access, getting pricing. If I'm that primary care doctor, I'm saying, well, what in the heck are we doing? Why am I doing this?
Yeah, well, yeah, no, we didn't really have any issues with that. And they hired their first full-time surgeon in county history too, Chris, with all the savings. They were hired their first full-time surgeon in county history.
Oh, wow.
It's a big deal. So we didn't really have the problems on that side. You said, because again, it's not like they have 20 doctors that they own, but I think everyone trusted them. And I think one of the coolest things that happened, Chris, when we did the benefit education means. We call them benefit education, not open enrollment. We ask all the employees, we do it in every client, every meeting we have. Hey, Chris, who do you think the insurance company is? It's Buca. And I'm like, no, it's the DeSoto Memorial Hospital. And you've got to educate these people that it's their plan. It's DeSoto built healthcare, and the decisions those employees make impact the people they're sitting next to in the meeting.
Yeah.
So that's what's critical. And most of these people have given this free real estate away on these ID cards and let the Buca get free advertising. It's crazy. And that's what we took it. It's our card says DeSoto and it says fair cost. And that's the difference, because it is DeSoto's plan. It's not Buca built healthcare. Mm-hmm. And that's another learning curve, Chris. Just I want to throw that out there to you, is these people that are employed at companies, many of them are self-funded. They have no idea. They think their coverage is with Aetna or Blue or whoever. They don't know. So
True. That's a great point. It's a great point. And that's why they don't think about being smart consumers too, because they're saying, well, I've been paying into this, so whatever, I don't care what it costs, if they're able to find out what the costs are. So yeah, continuing that employer built plan, that seems to go hand in hand with educating people about that. Wanted to ask you, how realistic is it to take that employer built plan, find out what has worked, find out how you've been successful, and replicate that? Is that a problem? Is that an issue that you're seeing?
It wasn't. Well, I would say this. We had some, how do I say this? I'm also known for this quote that everybody's heard me say. All TPAs suck is finding the least sucky of the suckiest. And we have located the least sucky of the suckiest. And it was through about 4 mistakes we made building fair cost with other TPAs. Fair cost isn't complicated, Chris. And if you want me to, or we have time, I would love to put a slide up or share a slide and let it build so you can really see what it is from a home perspective, thinking about a home. So you tell me if we get to it. I think it'd be powerful. The only thing an employee needs to know in our health plan is where the front door of the house is. One call, that's all. They don't need to know the plumbing, the electrical, the chronic kidney disease management solution, the musculoskeletal solution, the bundled joint program. They don't need to know that stuff. They're guided through our cost and quality company. And when they open that front door, that's all they need to know. And so we've kept it very simple. But unfortunately, these TPAs, Chris, we deploy what's called a benefits champion in our plans. And that is a person that works for the employer. And generally, their only job is to be a benefits champion. Literally, they are the champion of the benefits. Liz Schrock at the Gas Berlin is famous now for that. Some people have taken off and run and copied this model. DeSoto has kind of someone like that there. But the reason I'm pointing that out is the benefits champion is a really critical part. But what we learned in this is we actually study the claims funding requests that come every Monday morning about 10. And we were looking at them, and the benefits champion was looking at them, and they would see all the mistakes made. Well, see, there are employers across America right now, we can name them, that are blindly paying claims that are not the right claims.
Yeah.
And
we've heard that before.
By doing that, Chris, we found all the mistakes the TPAs made. It wasn't because fair cost is so complicated. It had nothing to do with that. Again, most of the components in fair cost aren't used until called upon. So most people will never even see the components in fair cost. Mm-hmm. It's the times when those situations arise, those situational things where that cost contained risk mitigation and better clinical outcomes and better financial outcomes show up. So that we saw that with TPAs, and we finally found a good partner. I'm glad to say it's Aether Health. They just won our big school district down in Florida, about 9,100 belly buttons. They won that this spring. They're going to be servicing and handling that for us. That went live October 1. So they're who we're doing everything with, and they're absolutely phenomenal. And I can't almost come to tears talking about them. I didn't know it was possible when you have a true partner. And some of the other ones were okay, but these guys have just knocked the cover off the ball. And we moved DeSoto there January 1 of 20.
Gotcha.
So the Aether is administering FairCo, 3 or 4 FairCo plans. So my point in telling you this is this thing is built, it's ready. Here are the keys. You just need to have some gas. You need to go put a little gas in the car, and it works. So it is replicable, and we have proven that, and we've done that.
Good. Glad to hear that one. Carl, we're going to take a quick break here. Listen to some messages from our sponsors, and we'll be right back after this. So there we go. We have the audio. Hi, everybody. Welcome back for the second half of our episode today. Joining me again is Carl Schuessler with Mitigate Partners. Carl, we're just talking about how to replicate plans such as yours and the Fair Cost plan. Want to talk a little bit about some of the headwinds that you face. Now, earlier in the episode, I said the bad word, the B word, broker, when in reality, what I meant was advisor. So are you getting a lot of challenges from brokers who are taking a look at what you're doing and saying, it's not really for me. I'm not going to steer my clients into this type of a plan?
Yeah. Well, that's a good question. I really don't call on brokers. First off, Chris, I'll talk to advisors. But we've got Mitigate Partners. To answer your question, there's 29 different offices now. Which is great, and everyone is independently owned and managed by those people. If we are helping, some we're mentoring, some we're just helping with fair cost. It varies office to office, but a lot of them we're mentoring and helping. And most of them have embraced it. We haven't done a ton of these yet, but most of them have embraced that. And these are more the forward-thinking people. A lot of them are health or Zeta advisors. The open collaboration, Dave Chase and Sean Shanson and their whole crowd, Melissa Taylor, they get a lot of credit for the open collaboration now that we're doing with these offices and sharing. And it's a group of, I'd say 90+% of Rosetta advisors. But we're just sharing, and we're conducting webinars every 2 weeks, except when I canceled the one last week due to my weakened condition. I could have risen to the occasion, but I felt like it was better not to. So I've got to get that back on track. But we are working with a lot of different people and helping them. And Chris, here's the thing. It's a complex sell. It's tough. It can be tough to explain. We spent a lot of time developing the materials, and that's why at some point today, again, I think it'd be worth it for me to play 2 slides for you to see them. That what it is, and think about it in the form of, think about a health plan as a house. Mm-hmm. So employer built, custom built healthcare like you do with a home, and brick by brick. So I think for the most part, those people have embraced it. I'm not really, if somebody's not interested or they're calling me, they heard about it and they're not really interested, we're pretty careful and protective, and I'm not going to twist somebody's arm. There's too many other people to help. I think the brokerage industry in general, Chris, is, dude, it's such a cartel, and I was a part of it 7 years ago. It is such a cartel, the way it's operated, and the amount of enforced bonuses someone gets, the more business they do with the BUCA. The things I could tell you, the 7th largest school district in the country, Hillsborough County down in Tampa, and I'm glad to say, and hope people out there are listening to what I'm saying, 24,000 people on this health plan. 7th largest school district in the country is fully insured. That broker should be thrown in jail. That is criminal. And that's what we're seeing all over. And we didn't even compete on that case, Chris. We didn't even compete on it. We read it. The qualifications were written by another cartel broker. Hey, if you don't have 3,000 years of experience and 10,000 life groups and have $100 million budgets, then you are out. Well, guess what? That leaves the cartel brokers, the Aons, the Willises, all of those guys. No offense, folks. Sorry. But I mean, that's what it leads. And all they do is support the BUCA agenda. And how you could be fully insured? Are you kidding me? I can tell you something. I know some of the board members there. I can tell when they're going to tinkle. That's how credible the data is on the people. I mean, come on.
Yeah, that sounds like a nice little nest egg for whoever that broker is. That's a lot of easy money that's being thrown out the door from the school system, right?
You can get in the deer stand a lot quicker on the golf course, a heck of a lot quicker than I do. I can promise you that.
Yeah, that you are just actually quite literally flushing money down the toilet when it comes to that. And then you probably have to go back to the taxpayers and ask for a budget increase just to throw more money out the window, right?
We know, Chris, the worst part of it is the school district Osceola County went a different way with us and our partner Provinsure on that school district case I was just sharing with you that went live kind of in more of the fair cost principles October 1 a week ago or a couple weeks ago. You won't even get a chance to be heard or present orally what you could do. And that's what we kind of asked out of the gate. How are you evaluating these people? RFPs never work generally, Chris, because they're oriented on how many windows do you have? And I don't actually have any windows in my office, so we would have definitely lost. But how many windows do you have? How many staff people do you have? A school district, 24,000 people, is not calling the advisor's office and talking with any of their account managers often because they're calling the third-party administrator. So a lot of these things like this are just unimportant. And the questions, the problem is, if you don't know the right questions to ask, you won't get the answers you seek. Mm-hmm. And how many windows and how many employees you have nothing to do with anything. The question ought to be, hey, here's our claims, here's all our facts. If you were us, what would you do for us? And they never ask that.
Sure, they probably don't know to ask that either. So I wanted to talk about your personal experiences here. Battling COVID. What's been going on? Because this is something that obviously you called me up yesterday and said, hey, I'm going to try to tough it out through this interview, but just to let you know, that's why we got our wheels turning, thinking, you know what, let's hear it from the horse's mouth here. How are you guys holding up?
Well, first off, thank you very much and appreciate any of those folks that know us have thrown some prayers our way. And also community pharmacists, I want to thank my good friend Dawn Butterfield, who's down in Brevard County, Florida, the Space Coast. She sent us some great stuff. Our pharmacy consultant, Chuck Gamsu, has been extremely supportive, and he's been one that won't go anywhere and go do any talks anywhere. And I laughed at him, and look who had the last laugh. They were great. So got some supplements, and we can talk about that later. But what I would tell you is we were very blessed, and we don't really know. We think it came from our daughter, and Chris is very tricky. You obviously got a newborn. I've got a senior in nursing school right now, a sophomore at Ole Miss, as I said, and a junior in high school. So the junior's here, and they stick to themselves. We have a good relationship, but they hang in a room. They're not hanging out with us every second. And that's part, you'll get, it'll be weird when it happens. You're like, hey, what's going on? The tide turned on. But long story short, she had some symptoms, I guess, and we just kind of like, whatever's a cold. Both of us grew up sons of physicians. My wife grew up son of a physician. Daughter of a physician. I grew up son of a physician. We didn't run the doctor. She had a cold. Okay, she has a cold. No big deal. Yep. And then later, it was like, hey, I did lose taste for 3 or 4 days or whatever. Well, when you get a head cold, you lose taste. And the reason I'm sharing this everybody out here, it's important because you never would have thought twice until COVID hit, even to think about COVID, right? It's just a cold.
Sure.
Well, it all started with me on September 30th. That evening, I was going to bed. I was coughing a little bit, whatever, no big deal. Next day I woke up and I had sounded like I had a cold, but there was no, gosh, how gory can we get it? No mucus, no that stuff going around my nose. And I'm sorry to be so detailed. And I'm like, okay, whatever. I still feel fine. Felt fine Friday. Saturday, my taste and smell went away. And on Monday, it still was gone. I'm like, this is weird. It's got to be COVID. I went and got tested. We took my daughter. She was negative. I was positive. So now we're all running around the house with masks on if we're around each other, right? Because it's tough in a household unless you live in a castle. We don't live in a castle. So my wife got tested. I got tested last Monday. My wife got tested Wednesday. She was really bad. And this is another important story I want to share with everyone. So I hope they're still listening and we haven't worn them out yet. Missy could barely talk. Her throat was like all closed up. you know, it was really bad. It's scary. So we went to the testing site. They're great. They do your vitals and everything was there. By the way, my pulsometer, we did checked our oxygen levels and heart rates and all that. And we've been in the mid 90s to high 90s the entire time. So we have been certainly careful and took it serious. There's no question about it. You know, at my ripe young age of 53, I got to be careful. So anyway, she went in there and her vitals, her heart rate was almost around 120. And the nurse practitioner was kind of freaked out. Her oxygen levels were great. And she goes, you need to go see your doctor, go to the ER. And we're like, you know, it was like just stunned, you know, and I'm not feeling great. I'm lightheaded. And last thing I want to be doing is getting in the car going to do this. So we take her right down the street, which is nice, where we live, to her primary internist, or actually her internist. And Chris, the internist wouldn't see her. The reason was because she was waiting on a test result from a COVID test. And I was just like flabbergasted. I've heard these stories, but I hadn't experienced it. And basically go to the ER. Are you kidding me? The ER is my only choice. She's struggling, but it wasn't like, oh, you got to go. But we were a little concerned. So we came back and we called our good friend, Dr. Lee Gross down in Florida, who, as you know, we've already covered, works with the SOTO, and just had a conference with him. And he's not our DPC doctor, of course, because he's in Florida. And we don't have one yet, but that's changing quickly. I'm embarrassed to say, and I'm always honest with everybody. And I got one that I met at DPC Nuts and Bolts last year when we gave the DeSoto Memorial Talk alongside Lee and Lois from the hospital that I met there. And he's in Vinings, about 10 minutes from me where I live. And long story short, he goes, well, her heart rate was high, probably because she's fighting the infection. Do you have any heart problems? No, never had any heart issues. And he goes, well, you might consider a steroid or something to bring some of the swelling in your throat down. I'm pretty sure it wasn't strep because the doctor and the nurse at the testing site looked. And we didn't get a swab or anything done. So we didn't find out she was positive for COVID on a Friday. Her test took a long time. I found out by noon the next day on mine. I did mine at 5 on Monday, found out Tuesday at noon.
Did they say why the discrepancy in the test results?
Why it took longer on hers? I don't know. It was weird, but the big thing was Dr. Gross said, do this and this. You don't need to go to any ER. I mean, that's crazy. And that right there in itself, Chris, and we talked about this, and I told my wife I was going to share it. Missy's been the poster child of a lot of our talks, and everybody's heard about her laparoscopy, her $29,984 laparoscopic appendectomy, and the $10,696 of billing errors on the bill, and everyone's heard that talk around the country. But I mean, this is ridiculous. And my father, when I called him to tell him I had it, again, remember, he's a 40-year OB-GYN and a knowledgeable guy too. I mean, he treated, obviously did a lot of gynecological visits and was a lot of women's doctors. So he knows about colds and basic stuff. And he said, son, you really need to talk to your doctor. I said, hey, Pops, my dad's he's about 77. And so I said, hey, Pop, no offense, man. I know you're my authority figure, but do you know what's really going on out here right now? In the fee-for-service environment, you ain't going to see any doctor if you got COVID. They ain't going to see you.
No.
And he didn't really know that. And that's what I want everyone out there to hear. If you get any symptoms, I mean, again, it goes against every bone in my body to go run, jump up and get a test. But you should just to know. And then monitor your oxygen as we have. And thank the Lord, we're blessed. And thank you, God. It's worked out okay. I'm a fatigued some or a little lightheaded at times, but other than that, my appetite came back, my taste came back. I lost it Saturday, not this Saturday, last Saturday, came back by Wednesday of last week. It's not 100% perfect, but I can taste and I can smell some. So our symptoms have been mild, but I still wouldn't wish it on anybody because I'd rather feel spectacular and, my normal self. So, I mean, but we've been blessed, and it's because we don't have those comorbidities, but the system's messed up, Chris, and the work you were doing and your brother, Adam, and I hope we'll do something down in Okeechobee that you know about. And that's with Stacey Nelson, another community pharmacist, just wonderful, wonderful. We're all about relocalizing care, and we love the community pharmacists, work with them hand in hand. I hope that, we've got to make a change as a country. I mean, I know that COVID pointed out all the fallacies in the system, but they just continue. And not to be able to see your internist and your only choice is the emergency room, there's something bad wrong with that.
Yeah, the ER should always be the last resort, right? And for that to be, yeah, well, better go there now. And then, people ask why are things so expensive, and why is there not price transparency? It's because of conversations like that. I'm sure that nurse practitioner thought she was doing you a favor, had your best interests in mind, when in reality it's like, no, go make a phone call, get on a video chat if the internist is worried about that test result. There's no reason why you can't hop on a video chat or a phone call and say, here's what's going on, what should I do? Just like you did, right?
Yeah, and we also have a telemedicine company we put in our FairCo plan. It's amazing. They're staffed by ER docs, so they work in triage all the time. And we did that as a follow-up to Dr. Gross, and it was pretty much the same advice. And and again, anyone out there, just you make sure you have a pulsometer or whatever, and have your oxygen levels checked and stuff like that. Because I think again, I'm not an expert. From what I've heard, getting in the 80s, you might get a little concerned. So we've both been in the mid 90s. Even we both walked around the block last night. I can't tell you I blistered it in record pace, but I came in, my oxygen levels were great. My heart rate was fine. So yeah, it's I never was a phobe about it, Chris, but it is serious, and obviously I didn't want to get it.
Sure.
I just feel like we should have gotten our daughter tested. I'm sure some people listening go, "Oh, you're a terrible parent." Well, I mean, again, it was a cold, whatever. It wasn't a big deal. She was fine, and it just life went by and the days went by, and again, she tested negative, and then everybody asked me, well, and of course she was over it. And of course she tested negative. And I said, you don't get the antibodies test? I said, I don't know that we want to go, and maybe Chris, you could enlighten me. I don't know that I want to go spend the money on the antibody test, because I want my daughter to take this serious and not let her defenses down. And just like me, I'm not going to get the antibody test because I'm going to treat it like I treated it before.
Yeah. I mean, being proactive, being smart. I don't think anybody's going to fault you on that one, essentially. And I definitely agree with you. That's something, don't really want to get. So I appreciate you sharing your story and, your experiences too, because I'm sure there's somebody out there who was like, well, yeah, I went to the ER and then what happened, right? At least you are an educated enough consumer in healthcare, or I should say medical care. And people out there listening will say, Chris said it again. So in medical care, you're educated enough to pick up a phone, and again, fortunate enough to have somebody on speed dial, like a personal physician or a personal friend, like we were talking about there. But I hope we can help you continue to proliferate your plans in DPC. So when you called us up and said, hey, we're going to this area in Florida, do you have anybody down there? That allowed us to go through and recruit some physicians in any state who are able to help and set up these plans and go into DPC practices. So it's been fun from a DPC side, because we're starting to see that next wave of physicians learn about it, I would say, and pique their interest and say, oh, wow, this can be an actual reality. A lot of the pioneers blazed a trail for us, and now we're looking at the doctors who are coming next, and then be able to team up with great organizations like yours is a real treat to see everything, kind of the whole community, not just a local community, but a business community who's active in this space, come together for one united cause. It's been a lot of fun. It's been a treat to watch the industry grow like that too.
It needs to get back to the Marcus Welby MD days. And Chris, you're a young guy, obviously, with a newborn. So if you don't know who that is, you got to go Google it, as I say to all you millennial types.
I know who it is. I say the Norman Rockwell vision of the romanticized, house calls and that type of stuff. So,
well, that's right. What I would say is, what we really tried to do, when you look at healthcare, healthcare is not national. It's not even regional. It's local. Mm-hmm. And we have to get back to that. And by relocalizing care, like we're trying to do at DeSoto, we're trying to do in Okeechobee, you got to get that willing employer, and we're not there yet, that will come and do this. But I will tell you, the care Having, as I call the local care team, the independent pharmacist, the DPC, the primary care, if you don't have, go to DPC or you want a choice for the PCP, or the specialist, and then that patient and that love triangle, as I call it. It sounds perverse, but the key is not having any interference from all these other people that the current system has. And when we build fair cost and employer built and community owned healthcare, we eliminate those people. So Dr. Gross can practice medicine. These community pharmacists can literally see people and get diabetic counseling. Things like that that are just missing. And why we're charging for diabetic test strips. Most Americans don't have $500 in their checking account, and we're charging them for test strips that they're not going to use. Their A1C goes off the charts. They end up in the ER. Then they end up as an inpatient admit, and they blow your health plan up. Why not give them the test strips and the drugs they need for free if they go meet with a community pharmacist like a Dawn Butterfield or Stacy Nelson once a month, synchronize the meds in a bag, and they get a 15-minute education. They walk out and they don't have to pay for their script.
Well,
what would that do? Do the opposite, as I always say. George Costanza, Seinfeld, I use it all the time. Do the opposite. If the broker tells you to raise your deductibles, do the opposite. Do the opposite of what you've always done in healthcare, and I bet you'll end up better.
I agree. And the reason why that perpetual wheel happens, Carl, is because there's no CPT code for curing somebody.
Right.
If you have a diabetic who's no longer diabetic, guess how much money you earn off of them in the subsequent years?
Right.
Nothing.
Exactly.
Nada.
But I tell you, bro, if you can get these things, get it back and do it local, I really believe you can fix things. And growing up a community pharmacist and Macon, Georgia, about 150,000 people, but we knew the pharmacists. And today, I mean, the cartel pharmacies, CVS, Walgreens, seriously, you go through a drive-thru, you ain't talking to pharmacists. That's the worst thing that ever happened. Is now we don't have any care being given. And I think those things are crucial. What you guys are doing is awesome, and I commend you. And I'm thankful to know you. And I hope we're going to do some work together, because get these DPC docs is getting back to taking care of people. My dad, as we talked about numerous times, he trained to take care of people. He didn't train to be on the phone with an insurance company, going through a pre-cert or prior auth or a peer-to-peer review with some fool that doesn't know anything about healthcare. These insurance companies ain't in the healthcare business. Anyone that thinks they're in the healthcare business are crazy. They don't know the first thing about healthcare. Period.
Yeah.
And so I get pretty jacked up, sorry. But my dad, sat there and dealt with it. I watched it, and I remember, I tell the story a lot, Chris, but I think it's important. In the late 80s, early 90s, right, I was getting ready to go to the Harvard of the South, University of Georgia, of course. I mean, it's only Harvard of the South there is. Some people like to say Vanderbilt. I don't know where that came from. But anyway, but the point I'm getting is I went to get a physical. August 1985. At Dr. May's office in this old antebellum home in Macon, black and white tile floor, beautiful old building. His office was in there, and I was getting ready to go in, and it was Macon is hotter than fire, man. It's hot as heck down there. And I sat there going in. I was sweating, and I knew Miss Yancey, who was the nurse practitioner, little fireball of a woman, was going to come out and grab my finger and get that razor blade and prick it. And then I was going to have that gauze pad on my finger for like 2 hours after. Today, people get the hole punch thing. They get off easy. You kids and all you people, you don't have a clue what it was like when I was coming along. So anyway, they get that razor blade and do it. So I was nervous. I look around the room, Chris, and I'm like, how many people do you think were in the room with me August 1985?
Probably none.
Well, you're the only guy that's ever gotten that question right. And I've told that story 1,000 times. That's correct. There was nobody in there because that was a healthcare visit, not an insurance visit.
Yeah.
We had what was called major medical back then. So my parents paid for that visit. Here's the bigger part. At that time, my mother had a bumper sticker on her car that said, "My doctor, my choice." And I get chill bumps talking about it, because that's when it all changed. And I'll never forget my dad, and I've told the story a bunch, but I'm gonna tell it one more time. My dad had a patient. Your wife came in and said, "Dr. Schuessler," my dad was not going to participate in HMOs or PPOs or anything. My dad opted against all of that. They had the best OB practice in Macon, Georgia, hands down, delivered more babies than anybody. They weren't going to participate. He just wasn't going to be a part of that. because I guess I get it from him, Chris, you're seeing all this passion, is he's a principled guy like I am. And I won't go to CVS. Missy will tell you, I ain't going to CVS to get a rapid test. No way. I ain't going to the cartel. I will not do it. I've done it once. It's a long story, but I had to. I didn't have a choice. There was no community pharmacy. But anyway, my dad, sat there, didn't do it. And then your wife came in and said, Dr. Schuessler, I've been coming with you for 20 years, and you're not in my network, so I'm going to have to change. And my dad was absolutely floored. And he said, that's it. It's over. And he was right. He was right. And obviously joined the networks and all that because they had to, because people made decisions with their wallet and not with what was best for them. And it was new and all that. So I think we can take it back and we can fix it. And I've tried to boil the ocean and that didn't work well for me. We got a Schuessler stick now. It's a metal rod with a mirror attached to the bottom of it. I have to roll it under the car before we crank it up every day. So that didn't work well for me. So we're trying to boil the creeks, the rivers, the lakes, and then get to the ocean. And that's what we can do in these communities and change these communities and face these communities and bringing them together. So it's community-owned healthcare, not insurer-owned healthcare. And
absolutely.
The DPC doctors are the most fundamental part. And I know you wanted to ask it, now we're almost out of time. The brokerage community hadn't embraced it. And you've been over it. Christy covered it. You've covered it with many other people outside of me. But a lot of the people, it's work. Let me tell you, Lois Hilton at DeSoto Memorial, she said it was not easy. These employees are walking out in the world for help using their health care without a BUCA logo on their card. Oh my God, what am I going to do without that BUCA logo on my card? And it's work, but it's work, and it's education. It's educating the employee and educating the front office of the doctors, because they generally are just not good. And they see a Blue Cross logo, even though they got to make a phone call to verify coverage. But Lois said it was tough, but it was worth it. And when asked on the Florida Rural Health Association back in late August that we were asked to speak on, one of the people on the webinar asked Lois, if you had to do it over again, what would you do different? She goes, I wish we had done this 3 years ago. So I think that's the highest compliment you can get. It's different. It's work. It's not easy. It ain't the easy button for sure. But boy, you'll have better clinical outcomes for your members and better financial outcomes, and you can save a community doing these right things.
Very well said. Very well said. And, during that conversation about insurance, I'm sitting here looking down. I got my insurance does not equal healthcare shirt on. Available on Healthcare Americana's site. So I might have to send you one of these suckers. They've been pretty popular. I will say that. Just, put it out there that health insurance does not equal healthcare. And we can't shout it loud enough from the heavens every time we get in these conversations. But hey, funny. You said it very, very well, sir. So I appreciate that. So we are going to be out of time here, and a little longer episode than we're used to, but that's okay. When we have good conversations like this and people listeners get something out of it, then that's always important, right? So the more minds, more education we can put out there, more minds we can change, the better off we're going to be.
Yeah. And Chris, I want to thank you so much for having me. And I don't know how I deal with my COVID brain here. I hope I was able to deliver a good message. I want to thank y'all for all the hard work you're doing and the commitment you're making to making a change. And the other thing I want everybody out there to hear is it is absolutely possible to do this. We're doing it. Christy Gupton is famous for saying all it takes is a good advisor and a little courage. And that courage is the courageous employer who takes that step. Our job, and what I've realized, Chris, as an advisor, our sell to that employer is, hey, we got your back. With all the work we've done, we can help you build your house and you'll be fine. But you have to have courage to do it. Then the other side of me goes where my friend Hunter Schultz, who does the Winning Healthcare Food Fights Without the Mess podcast and Zoomcast, he says, Mount Everest was once unclimbable. Now there's a litter problem on the mountain. All the oxygen bottles, all the people that have done it. So the message I want to leave everyone with is, it is possible. And guys, there's no more excuses. We've done this with 5 companies in the Fair Cost Plan, municipalities, you name it. It's not just for private employers. So there's no more excuses. We need to get out there and do something about it, or otherwise healthcare is going to be done to all of us. which will not have a good result. And
No, we're already seeing that too, aren't we?
yeah, there's hope is, I guess what I'm saying, but no more, oh my God, that Chris, you're not an early adopter. We've been doing it. I say, hey, where you been, man? Get with the program. I mean, all our
welcome to the light side, right?
Yeah, a lot of Rosetta advisors, a lot of Mitigate partners, a lot of these folks are all doing it around the country. We're not unique.
That's right. Well, Carl, thanks for joining us again. It's Carl Schuessler, co-founder, managing principal of Mitigate Partners. For more information about direct primary care, visit freedomhealthworks.com. And to catch all of our episodes and hear our sponsors, visit healthcareamericana.com. Thanks for listening. Until next time.